smoothie in just a couple of minutes, but I think we'll go ahead and get started. Because it's only just a small group on this snowy day, if you have questions as we go along, feel free to ask. First question was, what do those letters mean behind my name? You know, it's really funny that a lot of my older patients that have been with me for a long time don't really know what I've been doing the past several years as far as improving my education. But you know, the BS is just a Bachelor of Science degree. I graduated from Ohio University in 1978, and of course the DC is a Doctor of Chiropractic. But in 2005, I became board certified in anti-aging medicine through the American Academy of Anti-Aging Medicine. And the next series of letters is just a fellowship with the American Association of Integrative Medicine. And what integrative medicine basically is a blending of, you know, what your medical doctors are doing with you with some alternative forms of treatment, you know, trying to get the best possible result in, you know, whatever the healthcare course that we might be taking. But anyway, those are what those letters indicate. But what we're going to do today is just talk about cholesterol. And just about everybody's heard of cholesterol. They understand what cholesterol is. Well, they don't understand everything it's all about, or they wouldn't have so many questions about cholesterol. But most of us have heard about cholesterol either via the news, TV commercials, a whole host of different ways, but a lot of patients don't really know what it is. And when I ask them what it is and how it can affect their health, I usually think, well, cholesterol, it's a fat that, you know, clogs my arteries that might cause me to have a heart attack. And then, of course, the next question is, what can we do to lower it? And a lot of us, patient-wise, you know, watch TV and they realize that, you know, there's a group of drugs called statin drugs, primary Lipitor, that's used to lower cholesterol levels, and hopefully, you know, in that process, try to, you know, prevent heart attack. Basically, what is cholesterol? Well, again, most of us think, or most patients think, most people think that cholesterol is a fat. But actually, it's not a fat at all. It's actually something called a sterol. And if you've taken any chemistry or biochemistry, you know about any substance that ends in OL, typically is an alcohol. And cholesterol truly is, it's just a waxy alcohol. It's considered to be a fat, but it's again considered to be a sterol. It's extremely important in a lot of body functions in our body. It's just not important in terms of what it does to block arteries. But one of the most important things that it does, it helps build and maintain cell membranes. And if we think about our body, you know, our body has just trillions and trillions of little cells. The cell wall in our body actually is composed, you know, primarily one of the ingredients is cholesterol. So if we don't have enough cholesterol in our diet, we don't have enough cholesterol in our bloodstream, you know, it affects our cell walls and how our cells work in our body. The cell walls are important because to get nutrients into a cell, to get toxins out of a cell, we have to have a nice, supple, flexible cell wall for that to cell to function properly. The other thing that a lot of people don't know is that cholesterol, especially LDL cholesterol, which is supposed to be the bad cholesterol, is a precursor to the formation of a lot of hormones in our body, especially the sex steroid hormones. Some of those hormones are testosterone, pregnenolone, estrogen, cortisol, which is a hormone we talked about last week in terms of the adrenal glands and how that affects stress, progesterone, DHEA, mineralocorticoids, glucocorticoids, hormones that affect the immune system, hormones that affect how we heal. A whole host of different hormones are actually produced by cortisol. Cortisol also produces all the fat-soluble vitamins in our body, or at least most of them, you know, including vitamin A, D, E, and K. So cholesterol is not really bad. It's only bad when it's in, you know, elevated levels in our bloodstream.
How elevated is elevated?
Good question. You're going to find out in about 2 slides.
Okay.
And in this, we'll have a listing of what the norms are. So, elevated cholesterol does increase the risk of atherosclerosis and cardiovascular disease. And atherosclerosis, if you're not familiar with what that term is, basically it just means plaquing in the arteries in our blood vessels. When we think about atherosclerosis, we think primarily about the blood vessels in our heart, because it's when those blood vessels get blocked, we can have a heart attack, or we can even lead to stroke. But atherosclerosis, or plaquing in our arteries, can occur in any blood vessel in our body. The blood vessels not only affecting the heart, but also down into our legs. The other thing interesting about cholesterol, it's insoluble in blood. And again, I said that was an alcohol. And basically, if you look at cholesterol, and if this little blue circles I drew indicated what cholesterol was, these are indicative of the waxy alcohol. The only way cholesterol actually gets transported in the bloodstream, something called LDL, or a low-density lipoprotein, or an HDL, a high-density lipoprotein, actually wraps itself around that waxy alcohol and carries cholesterol to the cells so it can actually produce and perform its functions of increasing the strength of the cell wall, but also producing hormones. So again, the low-density lipoproteins, the LDLs, primary function, they actually carry cholesterol to cell sites for use. The HDLs, which are the high-density lipoproteins, actually carry cholesterol away from cells. And where that's important is in the blood vessels. The low-density lipoproteins, the bad lipids, actually are the ones that actually can damage the walls of our arteries, which actually can cause plaquing, whereas the high-density lipoproteins are denser, they're heavier, and they actually take the cholesterol away from the blood vessels and the linings of the blood vessels and help prevent plaquing. So that's why HDLs, when you go see your doctor, HDLs are really important, and it's important for them to be at a normal level and LDLs to also be at a normal level. And as I just said, LDLs are thought of as the bad cholesterol. But again, it's the LDL form of cholesterol that actually forms most of the hormones, or the sex steroid hormones in our body. And as I previously mentioned too, LDL cholesterols make up our cell walls. But what's important about understanding about low-density lipids, or LDLs, LDLs in themselves are not what cause inflammation in blood vessels. They're not what cause plaquing in blood vessels. It's only when these LDLs get oxidized that they actually can cause damage to the cell walls or the arterial walls in our body. And there are blood tests that we can do to actually measure oxidized LDLs. We find a lot of the patients that we have, especially if they've got cardiovascular disease of any sort, a lot of times our cardiologists are constantly trying to drive down these LDL values in their bloodstream, and I think sometimes almost to dangerously low levels. And if you think about what a cardiovascular specialist is looking at, they're looking at heart, they're looking at blood vessels, they're looking at vascular function, and I guess in a sense I can understand why they want to drive down LDLs, but I always question, well, if we drive them down too low, how's that going to affect the way the rest of our body works in terms of hormones and cellular activity? So these oxidized LDLs, which we'll talk about in just a second in more detail, really are the bad LDLs. So all LDLs aren't bad, it's just the oxidized LDLs that are. And as we previously stated, the HDLs are thought of as the good cholesterol. They carry the blood cholesterol away from the arterial walls. They actually help kind of clean our arteries. You can kind of think of them like being a roto-rooter of the arteries, but they help cleanse the arteries. So what about oxidized LDLs? As I said, they're the ones that really we have to be concerned about. More and more physicians I see, more and more cardiologists I see, are actually starting to measure oxidized LDL levels in patients' blood in their laboratory testing, which again is, I think, more indicative of not only the amount of inflammation that may be present in their blood vessels, but how to better approach controlling LDLs and HDLs. As I said, oxidized LDLs injure the endothelial cells that cause inflammation. And if you look at a blood vessel, this drawing that I made, if you take a look at a blood vessel, or I took an artery out of your heart, there are 3 different layers of muscle around the blood vessel itself. The inner lining of the blood vessel is basically made up of a series of cells called endothelial cells, a real thin layer of cells.